Two brothers, same genes, same family history, both have high PSA. Mark is 61. His twin brother Steven is also 61. Obviously, they're twins. 3 years ago, both of them started taking zinc for their prostates. Same dose, same brand, same routine. Today, Mark's PSA is down to 3.8. He feels great. His symptoms are gone. Steven's PSA is up to 8.2. He's in the hospital. His kidneys are struggling. His immune system is compromised. The doctors say zinc toxicity. How is this possible? Same genes, same supplement, same dose. Two completely different outcomes. One brother thriving, one brother hospitalized. The answer shocked their doctors, and it reveals something critical about zinc that most men don't know. Zinc isn't about the dose. It's not about the brand. It's about whether your body can handle it. Steven had a genetic variant, a genetic difference that affects how his body processes zinc. He had no idea. Most people with this variant have no idea. They take zinc thinking it's helping, and it slowly causes serious health problems. But for Mark, zinc was exactly what he needed. His body processes it normally. He had a deficiency. Zinc fixed it. His prostate responded. His PSA dropped. Now, before I continue, I want to be clear. Steven's case is rare. Most men do not have the condition he has, but his story teaches us something critical. Zinc affects different bodies differently, and today I'm showing you how to know if zinc is right for your body. Here's the terrifying part. You could be like Steven, taking zinc right now, thinking you're helping your prostate, while zinc is actually making everything worse. Or you could be like Mark, desperately needing zinc but afraid to take it because you heard it's dangerous. Before we get started, just a quick note: this video is for educational purposes only. It's not medical advice, and it's not meant to replace your doctor's care or any treatment you're currently following. Everyone's body reacts differently. So if you have prostate issues or you're managing high PSA levels, talk with your healthcare provider before making changes to your diet. Today, I'm showing you how to know which brother you are, the 5 signs that zinc may not be appropriate for you, and the 4 signs that you may benefit from zinc. By the end, you'll know exactly where you stand. Let's start with the situations where zinc may not be appropriate. The 5 signs to discuss with your doctor before taking zinc. Before we dive into the 5 signs, you need to understand something. Zinc is not like vitamin C. You can't just take more and more without consequences. Your body needs zinc in a very specific range. Too little research suggests your prostate may swell and PSA may climb. Too much, you may develop zinc toxicity. The range between not enough and too much is smaller than you think. And here's what makes this complicated: some men absorb zinc really easily, others barely absorb it at all. Same dose, completely different blood levels. That's why Steven ended up in the hospital while Mark thrived. So the 5 signs I'm about to show you, these are warning signs that your body may not handle zinc well, that you may be in Steven's category, not Mark's. Let's start with number 5. Number 5, you're already taking copper supplements. Number 5 seems obvious once you hear it, but thousands of men are making this mistake right now. If you're taking copper supplements, you should talk to your doctor before adding zinc. They can interfere with each other, and it can cause problems. Let me tell you about George. George is 64, high PSA, so he started taking zinc. He saw improvements. After 2 months, his PSA dropped from 6.2 to 5. For then his wife read that copper is good for heart health, so George started taking copper 215 milligrams daily. Within weeks, his improvements reversed. His PSA went back up to 6.1. His prostate symptoms returned. He was waking up 5 times a night again. He felt exhausted all the time. His doctor finally figured out, you're taking zinc and copper together. George nodded. They compete for absorption. His doctor explained, when taken together, neither works optimally. George was wasting his money and confusing his body. Here's what happens: zinc and copper use the same pathway to get into your cells. Think of it like 2 people trying to go through the same door at the same time. Neither gets through efficiently. When you take high-dose zinc, it can reduce copper absorption. Your copper levels may drop. That can affect your heart, blood vessels, and nerves. When you take high-dose copper, it can reduce zinc absorption. Your zinc levels may drop. Your prostate symptoms may return. Taking both together, your body has difficulty processing both effectively. Both levels become unpredictable. Some days you're absorbing more zinc, other days more copper. Your symptoms may fluctuate. If you're taking copper for any reason, heart health, anemia, connective tissue support, talk to your doctor before adding zinc. If your doctor determines you need both, they should be taken at different times. Zinc in the morning with breakfast, copper in the evening with dinner, at least 8 hours apart. But in most cases, your doctor can help you determine which one is more appropriate for your individual situation. For prostate health specifically, research suggests zinc may be more beneficial. That's number 5. Now, number 4 is about a medication millions of men take every single day. Number 4, you're on blood pressure medication. If you take medication for high blood pressure, zinc may interfere with your medication. This is an important interaction to discuss with your doctor. Let me tell you about Dennis. Dennis is 58. He's had High blood pressure for 5 years, controlled with medication, no problems. Then his PSA started climbing 4, 1, then 4, 9, then 5, 6. He started taking zinc 50 milligrams daily. 3 weeks later, Dennis woke up dizzy. His vision was blurry. He felt like the room was spinning. He checked his blood pressure, 180/110, dangerously high. His wife drove him to the emergency room. The doctors stabilized him, got his pressure back down. Then they asked about supplements. Dennis mentioned the zinc that may be interfering with your blood pressure medication. The doctor explained the zinc could be affecting how well your medication is absorbed. Dennis couldn't believe it. He was taking his medication every single day, but the zinc was potentially reducing its effectiveness. His pressure had spiked. Here's the science. In simple terms, zinc can interfere with a class of blood pressure drugs called ACE inhibitors. Common names you might recognize: lisinopril, enalapril, ramipril. Millions of men take these medications. Zinc can bind to these medications in your stomach. When this happens, the medication may not be absorbed as effectively. Your blood pressure may not be controlled as well, but you don't know it because you're taking your medication every day like you're supposed to. You think you're protected, but the zinc may be reducing effectiveness. Zinc can also interact with another class called calcium channel blockers, amlodipine, diltiazem, nifedipine. The interaction isn't as strong, but research suggests it can occur if you're on blood pressure medication. Talk to your doctor before starting zinc. Do not start zinc without medical guidance. If your doctor says it's appropriate, you must monitor your blood pressure regularly. Take zinc and medication at least 4 hours apart. Get your pressure checked by your doctor frequently. In many cases, if your blood pressure requires medication, your doctor may recommend focusing on other approaches for prostate health rather than zinc supplementation. It's important to prioritize your blood pressure control. Blood pressure medication interactions are serious, but number 3, this one affects antibiotic effectiveness. Number 3, you're taking antibiotics. Number 3 is about antibiotics. If you're on antibiotics for any reason, zinc may reduce their effectiveness. This is important to understand. Let me tell you about Carl. Carl is 62. He got a urinary tract infection, pretty common when you have prostate issues. His doctor prescribed antibiotics, tetracycline. Carl was also taking zinc for his prostate, 40 milligrams daily. For 3 months, the infection didn't improve as expected. In fact, symptoms persisted. The discomfort continued. Carl went back to the doctor. His doctor was puzzled. These antibiotics should have worked by now. He ran more tests. The bacteria were still present. Finally, the doctor asked about supplements. Carl mentioned the zinc. That may be the issue. The doctor said zinc can bind to certain antibiotics and reduce their absorption. Carl stopped zinc, continued the antibiotics. Within days, the infection began to clear. Here's what was happening. Zinc can bind to certain antibiotics in your digestive system. When they bind together, the antibiotic may not be absorbed effectively. It may pass through your system without working properly. You're taking the medication, but it may not be as effective. This can occur with several antibiotic classes: tetracyclines, that's tetracycline, and doxycycline, quinolones, that's ciprofloxacin, and levofloxacin. These are commonly prescribed antibiotics, especially for urinary and prostate infections. If you're taking zinc while on these antibiotics, the treatment may not work as well. The infection may persist. It may become more difficult to treat. Bacteria may develop resistance. If your doctor prescribes antibiotics, stop taking zinc temporarily. Don't resume zinc until you've completed the full antibiotic course. If you have questions about timing, ask your pharmacist or doctor. They can advise you on the appropriate separation time. In most cases, stopping zinc for 1 to 2 weeks while on antibiotics is the safest approach. Your prostate health won't be significantly affected by this brief pause. Antibiotics are temporary. But number 2, this involves a chronic condition many men have. Number 2, you have kidney problems. If your kidneys aren't working optimally, zinc supplementation requires careful medical supervision. This is really important. And here's what concerns many doctors. Some men with high PSA also have early kidney issues. They may not have obvious symptoms yet, but their kidneys are under stress. Adding zinc without medical supervision can potentially worsen kidney function. Let me tell you about William. William is 67. He'd had slightly elevated creatinine for years. His doctor said your kidneys are functioning, but we should monitor them. William's PSA was climbing 5, 8, then 6. For he started taking zinc 60 milligrams daily. He wanted results quickly. 6 months later, routine blood work showed changes. His creatinine had increased significantly. His kidney function had declined from 70% to 45%. His doctor was very concerned. Have you changed anything? Started any new supplements? William mentioned the zinc. We need to stop that. Immediately his doctor said your kidneys are having difficulty processing that amount. William stopped zinc right away. 3 months later his kidney function improved to 58%, not back to baseline, but better. The high-dose zinc had affected his kidney function. Here's why this happens. Your kidneys filter everything you consume, including zinc. When your kidneys are healthy, they handle zinc well, but when they're already under stress, high dose zinc requires extra work. Zinc supplementation increases the kidneys' workload. They have to filter it from your blood. If they can't keep up, zinc levels may rise in your system. This can lead to toxicity, which may further stress kidney function. It can become a problematic cycle. Also, zinc affects how your kidneys process other minerals. It can affect electrolyte balance. Sodium, potassium, calcium, all may be affected. For men with kidney issues, this requires careful monitoring. If you have any kidney concerns, elevated creatinine, reduced GFR, that's glomerular filtration rate, history of kidney stones, or diabetic kidney disease, do not take zinc supplements without talking to a nephrologist or your primary care doctor first. Even if your doctor says your kidneys are functioning, if they're not optimal, zinc requires medical supervision. Get your kidney function tested before starting zinc. Test again after 3 months. If you begin supplementation, monitor for changes carefully. If you notice swelling in your ankles or feet, decreased urination, foamy urine, or unusual fatigue, contact your doctor immediately. And stop. Zinc kidney function is precious, but number 1, this involves rare genetic conditions that require screening. Number 1, you may have Wilson's disease or hemochromatosis. Number 1 involves rare genetic conditions most men have never heard of, but if you have one of these conditions, zinc supplementation can cause serious complications. Now, before I explain this, I want to be very clear. These genetic conditions are rare. Wilson's disease affects approximately 1 in 30,000 people. Hemochromatosis is more common, affecting roughly 1 in 200 to 300 people. Most men watching this video do not have these conditions, but if you do have one of them, it's critical to know before taking zinc. Let me tell you about Stephen from the beginning, Mark's twin brother. This is what Stephen had. Stephen has a genetic variant called ADP7B mutation. It's associated with Wilson's disease. His body can't eliminate excess copper properly. When he took zinc, it created complications. Zinc affected how copper was distributed in his tissues. His liver function was affected. His neurological system showed changes. His kidneys were stressed. Mark doesn't have this mutation. His body processes minerals normally. Zinc helped him significantly. The concerning part, Stephen didn't know he had this genetic variant until he became seriously ill. Many people with these genetic differences don't know until complications occur. Here's what these conditions are. Wilson's disease means your body can't eliminate copper properly. Copper can accumulate in your liver, brain, and eyes. Hemochromatosis means your body absorbs too much iron. Iron can build up in your organs. Zinc supplementation can complicate both conditions. In Wilson's disease, zinc can affect copper distribution in ways that may worsen symptoms. In hemochromatosis, zinc can interfere with treatment approaches. If you have either condition and take zinc without medical supervision, you may experience serious complications. How do you know if you might have these conditions? Wilson's disease warning signs include yellowish discoloration in the eyes from copper deposits, tremors or coordination difficulties, mood or personality changes, and family history of liver disease at a young age. Hemochromatosis warning signs include chronic fatigue, joint pain, bronze or gray skin discoloration, and family history of iron overload or early heart problems. If you have any of these signs, talk to your doctor about genetic screening before taking zinc. It's a simple blood test. If you're diagnosed with either condition, zinc supplementation should only occur under specialist supervision. In most cases, specialists will recommend avoiding zinc supplements entirely. Those are the 5 situations where zinc requires careful medical evaluation: taking copper supplements, on blood pressure medication, on antibiotics, have kidney concerns, family history of mineral metabolism disorders. Talk to your doctor before starting zinc. But now, let's flip this around, because there are 4 signs that suggest you may benefit from zinc. For situations where zinc deficiency may be contributing to your prostate issues. Here's the thing: for every man who needs to be cautious with zinc, there are many more men who may have zinc deficiency. Men whose PSA may be elevated partly because their zinc is too low. Men whose prostates may be swollen because they're deficient. Men who are waking up 5 times a night because their bodies need more zinc. So, how do you know if you're one of them? These next 4 signs will give you clues. If you have even one of these signs, you may benefit from getting your zinc levels tested. And if you're deficient, appropriate zinc supplementation may help improve your symptoms. Let's start with number 4. Number 4, white spots on your fingernails. Look at your fingernails right now. Do you see small white spots or streaks? Not the whole nail white, just little spots. That's sign number 4, and it's one of the most visible indicators of possible zinc deficiency. Those white spots are called leukonychia, but forget that medical term. What matters is what they may indicate. Research suggests these spots can signal that your body may not have enough zinc to build healthy nail tissue. Nails are made of protein called keratin. Zinc plays an important role in keratin production. Without adequate zinc, nails may not form properly. Those white spots can be the result. Now here's why this may matter for your prostate. If you don't have enough zinc for your nails, you likely don't have enough for your prostate. Research shows the prostate has exceptionally high zinc requirements, much higher than nails. Let me tell you about Raymond is 59. He'd noticed white spots on his nails for years, thought it was normal. His PSA climbed to 6. He went to a nutritionist for dietary advice. The nutritionist looked at his hands. Those spots may indicate zinc deficiency. Raymond asked his doctor to test his zinc levels. They were low. He started 30 milligrams of zinc daily under medical supervision. 8 weeks later, the new nail growth had no spots, clear, healthy nails. 12 weeks later, his PSA dropped to 5. His nighttime bathroom trips decreased significantly. Those white spots were possibly his body's warning sign. He just didn't know how to interpret it. Check your nails. If you see white spots, you may want to ask your doctor about testing zinc levels. If testing confirms deficiency, zinc supplementation of 25 to 30 milligrams daily may be appropriate. Within 6 to 8 weeks of appropriate supplementation, new nail growth should be clearer. That's one way to monitor if supplementation is working. White spots are easy to see, but number 3, this one is about infection frequency. Number 3, frequent infections. If you get sick frequently, you may have zinc deficiency. Cold after cold, flu every year, that stomach bug you got it, urinary tract infections multiple times a year. This is sign number 3. Zinc is important for immune system function. It supports white blood cell activity. Without adequate zinc, white blood cells may not function optimally. You may get infections. More frequently, infections cause inflammation throughout your body, including potentially in your prostate. And here's the connection. Research suggests chronic infections may contribute to chronic inflammation, which may affect PSA level. Studies have found that men who get 4 or more infections per year often have lower zinc levels, higher PSA levels, and more prostate symptoms. These factors appear to be connected. Let me tell you about Frank. Frank is 63. He got sick 6 times in 1 year, 3 colds, 2 cases of flu, 1 urinary tract infection. His PSA was 7. His doctor treated each infection separately, but didn't look at the overall pattern. Frank read about zinc and immune function. He asked his doctor to test his zinc levels. They were significantly low. His doctor recommended 40 milligrams of zinc daily. Initially, that's a higher dose because he was severely deficient. This was done under medical supervision with planned retesting the next year. Frank only had 1 minor cold, just 1. His PSA dropped to 5. 8 over 6 months. His doctor was impressed. Frank said, improving my zinc levels seems to have helped my immune system, and my prostate health improved too. If you get sick more than twice a year, you may want to discuss zinc testing with your doctor. If you're found to be deficient, supplementation of 30 milligrams daily may be appropriate. Give it 3 months with medical monitoring. Track how often you get sick. Many men report significant improvements in infection frequency. Getting sick frequently is noticeable, but number 2, most men never connect this symptom to possible zinc deficiency. Number 2, slow wound healing. Do cuts and scrapes take a long time to heal? That paper cut that's been there for 2 weeks, that scratch that won't close, this is sign number 2, and it may indicate that your zinc levels are low. Zinc plays an important role in tissue repair. When you get a cut, your body needs zinc to form new skin cells, build collagen, close the wound, and support healing processes. Without adequate zinc, wounds may heal slowly or may not heal optimally. Now here's why this may matter for your prostate. If your body can't heal a simple cut efficiently, it may also struggle to resolve inflammation in your prostate. Prostate tissue healing and general wound healing use similar zinc-dependent processes. Slow wound healing may suggest zinc deficiency, which may also affect prostate health. Let me tell you about Arthur. Arthur is 68. He cut his hand working in the garage. Small cut should have healed in a week. 3 weeks later, it was still open, still not healed properly. His wife insisted he see a doctor. The doctor examined the wound and asked about other symptoms. How's your prostate health? Arthur's PSA was 8. The doctor tested his zinc levels. They were quite low. Arthur started 30 milligrams of zinc daily under medical guidance. The wound healed within 10 days of starting supplementation. His PSA began declining after 2 months. After 6 months, it was down to 6. 9. The connection seemed clear. Pay attention to how quickly you heal. Minor cuts typically heal in 5 to 7 days. If they consistently take 2 to 3 weeks or longer, you may want to discuss zinc testing with your doctor. If testing confirms deficiency, supplementation of 25 to 30 milligrams daily may help. You should notice faster healing within a month of appropriate supplementation. Slow healing can be subtle, but number 1. This is the most significant indicator of severe zinc deficiency. Number 1. Loss of appetite and unintended weight loss. Number 1 is the strongest indicator of potentially severe zinc deficiency. If you've lost your appetite, if food doesn't interest you anymore, if you're losing weight without trying, you may have significant zinc deficiency. This requires immediate medical evaluation. Zinc is essential for taste perception, smell perception, appetite regulation, and metabolism. Without adequate zinc, food may taste bland. You may have little desire to eat. Your body may start breaking down muscle you lose. Weight unintentionally, muscle mass decreases. This is sometimes called zinc deficiency-related wasting. It's serious and requires medical attention. And here's the prostate connection. Research suggests men with severe zinc deficiency may experience rapid PSA increases. We're talking potentially going from 4 to 9 in 6 months in some cases, because the prostate depends so heavily on zinc. When zinc drops to very low levels, prostate function may be significantly affected. Let me tell you about Leonard. Leonard is 71. He lost 20 pounds in 4 months. He wasn't trying to lose weight. He simply had no appetite. Food tasted like nothing. His PSA went from 5.2 to 9.7 in approximately the same time period. His doctor was concerned about serious illness, ran extensive tests. No cancer was found, but there was significant inflammation. Finally, zinc levels were tested. They were critically low. Leonard started 50 milligrams of zinc daily. This high dose was used short-term under close medical supervision. With frequent blood testing, his appetite returned within 3 weeks. His PSA began declining after 2 months of treatment. Now it's at 6.4 and continues to improve slowly. Leonard is regaining weight gradually. His prostate inflammation is resolving. Addressing his severe zinc deficiency appears to have helped significantly. If you've lost your appetite and you're losing weight unintentionally, see a doctor immediately. Ask for comprehensive testing, including zinc levels. If severe deficiency is found, you may need higher dose zinc supplementation, 40 to 50 milligrams for a short period. This should only be done under direct medical supervision. With regular blood testing, this is not something to self-treat. You need professional medical guidance, but with appropriate treatment, zinc deficiency can be corrected and prostate health may improve as a result. So now you know both sides. The 5 situations where zinc requires careful medical evaluation, the 4 signs that may indicate you have zinc deficiency. But how do you know for sure what your status is? Get tested. It's straightforward, it's affordable, it's definitive. Ask your doctor for a serum zinc test. It's a standard blood test most labs can perform it. The normal range is typically 60 to 120 micrograms per deciliter. If you're below 60, you likely have deficiency and may benefit from supplementation. If you're 60 to 80, you're in the lower normal range and might benefit from evaluation. If you're 80 to 120, you're in the optimal range and likely don't need supplementation. If you're above 120, you may be getting too much and should discuss this with your doctor immediately. Also, consider testing for copper levels. Should be 70 to 150 micrograms per deciliter. Kidney function, including creatinine and GFR, and liver function. If there's any concern about mineral metabolism disorders, these tests help determine if you need zinc, if it's safe for you to take it, and what dose may be appropriate for your individual situation. Don't guess, don't assume. Get proper testing. If you start taking zinc supplementation, get retested after 3 months. Verify that your levels are improving appropriately. Make sure you're not going above the optimal range. If your zinc rises above 120, discuss reducing your dose with your doctor. If it goes above 150, stop supplementation and consult your doctor immediately. Also, monitor your PSA levels. They should show improvement over 3 to 6 months. If zinc deficiency was contributing to elevation, your symptoms like nighttime urination frequency and stream strength, and your overall health markers like energy levels and immune function, zinc supplementation should be monitored, not guessed at. Test, supplement appropriately, retest and adjust. That's the proper protocol. And always work with your healthcare provider, especially if you have any of the 5 situations we discussed that require extra caution. Let's recap everything. 5 situations where zinc requires careful medical evaluation before supplementation: taking copper supplements on blood pressure medication, currently taking antibiotics, have kidney function concerns, or Possible genetic mineral metabolism disorders, 4 signs that may indicate zinc deficiency: white spots on fingernails, frequent infections, slow wound healing, and loss of appetite with unintended weight loss. The key to making good decisions: get proper testing, know your actual zinc status, work with your doctor to determine what's appropriate for your individual situation. Comment zinc below right now. Tell me, do you have any of the situations that require caution, or do you have any of the signs that may indicate deficiency? I'll send you a complete guide on testing, what to ask your doctor, what lab tests to request, and how to interpret your results. I'll reply personally for 24 hours. If this information was helpful, click the like button, share it with someone who's confused about whether zinc is right for them. Subscribe, because my next video covers 3 dietary factors that can increase zinc absorption by up to 300%. You could be taking zinc and getting minimal benefit if you're not eating the right foods with it. Remember, the 2 brothers, Mark thrived with zinc supplementation. Stephen experienced serious complications. The difference wasn't the zinc itself, it was how their individual bodies processed it. Know which category you're in, get proper testing, make informed decisions with your doctor. Your prostate health is important enough to do this right.